Welcome to the Specialty Pharmacy Podcast. This Specialty Pharmacy Podcast is a collaboration with the National Association of Specialty Pharmacy, the NASP, and the Pharmacy Podcast Network. The mission of the National Association of Specialty Pharmacy is to improve specialty pharmacy practice by promoting continuing professional education and certification of specialty pharmacists, while advocating for public policies that ensure patient access to specialty medications. As the healthcare industry's leading podcast dedicated to the pharmacy profession, the Pharmacy Podcast Network is proud to bring our listeners the Specialty Pharmacy Podcast in partnership with the NASP.
Welcome to another episode of the Specialty Pharmacy Podcast, part of the leading Pharmacy Podcast Network. I am your host, Christopher Kennedy, and today our special guest is a thought leader in the patient experience movement and the president of the Barrell Institute. Please welcome Jason Wolf. Jason, thanks for joining us, first of all, and it's an exciting opportunity to spend some time with you today. So thanks again for jumping on.
Thanks so much, Christopher, for having me. I really appreciate the chance to spend some time with you today.
Well, great. So we like to kick off here on the Specialty Pharmacy Podcast with kind of the first question. That's really to get to know who we're spending time with today. So I guess we'll kick off with the question, who is Jason Wolf? Where have you been? Where are you going? What are you currently doing, et cetera, et cetera?
Well, I appreciate that. Currently, as you alluded to, I'm the president of the Barrell Institute, and I know we will speak a bit about that here in a few minutes. I also have had the opportunity to launch our Patient Experience Journal, so I'm the founding editor of that, and it's the academic in me, as well as the founding president of the Patient Experience Institute, where we provide professional certification for certified patient experience professionals. It's interesting because my background really has me come at this work from two prongs, and I think it will set the context of a lot of what we talk about. I'm both a trained diplomat through my education, as well as sort of a social cultural anthropologist from my additional research. And so I kind of do look at this stuff from the lens of bringing people together, as well as understanding how the cultures of organizations work. And most recently, prior to starting the patient experience, spent a number of years within the HCA healthcare system, inside the operations of that entity, really seeing how healthcare works from the inside out, and having experience both from the outside in prior and during, I think hopefully bring a good perspective at what this whole conversation can be about and should be about as we look to move forward in the healthcare.
Well, thank you. And I think, it's definitely insightful to learn about your background. I can speak from firsthand experience. When I Google Jason Wolf, there's a lot of great videos out there, and I truly appreciate the perspective that you've shared within this growing movement. I guess it would be great to kind of get a feel for what is this Barrell Institute. I know when I first came across this, I did not know a lot about it. Since that time, I've learned a tremendous amount about the patient experience, but more importantly, probably the educational aspect that the Barrell is really behind. So can you give us some highlights of the overall organization and the history, et cetera?
Yeah, I would just say, the Barrell Institute in its current form as a membership and community organization and community practice started back in 2010. We have some roots prior to that in terms of an organization committed to improving the customer experience in healthcare. And in 2010, we focused this entity on truly becoming a global community of practice dedicated to improving patient experience. And our focus has been on doing that through collaboration and shared knowledge. So we truly operate from a community of practice model. We have been designed to continue to operate with the mindset that we don't sit in some corner, in some office, in some place you don't know and tell people what they should know about patient experience. But instead, we have worked, I think, very diligently and with great and unwavering commitment to be a community of practice. That is, we bring people together from literally all around the world to share what's working and not working for them, share practices, processes, program ideas, lessons learned, the good, the bad, and the ugly, to help everyone improve the healthcare conversation around what experience ultimately is. And so the Barrell Institute, in its last 7 years of operating, has grown as a membership organization to include over 55,000 people in more than 70 countries around the world in this conversation, coming together to share ideas and resources to truly work on making improvement. And it has been quite an exciting 7-year journey. I know we'll speak to some extent the definition of patient experience that the Barrell Institute bases its work on, which is the sum of all interactions shaped by an organization's culture that influence patient perceptions across the continuum of care. And that was something we did that very first summer, in the summer of 2010, as we got underway, to say if we're going to be about experience, we have to be very clear about what we mean. And you'll hear those themes around interactions, culture, perceptions of patients and families, and the idea that this truly is a cross-continuum conversation come out in a lot of the things that we discussed today.
Yeah, it's amazing when you say impacting around the world, and you rattle off, I think you said 70 countries. That's something that I think, and from a noisy perspective of hearing a lot of jargon out there, when you say that, that's something the Barrell Institute has lived out over the past, years, right? So you're actually, I think you just mentioned you've returned from 5 different continents this year you were on?
Yeah, physically on 5 different continents this year. And I think it raises a very important point that I think you and I have talked about before, that this patient experience conversation isn't about just how we treat people better or how happy we make people or about satisfaction. We're talking about the fundamental nature of how we deliver care. And how we take care of the people delivering care and all of the systems, processes, and programs that go into providing that comprehensive experience. So I think it's why it's so important we're having this conversation today. Even in the specialty pharmacy space where people might not feel like they're directly connected to it, in fact, you're vital to this conversation. And so we see it as a reality regardless of what kind of healthcare system we operate in around the world, or what our role might be, or where we sit on the care continuum. That everyone plays a role in the experience of those in healthcare, and that means both the experience of those we care for and serve, as well as those in the process of delivering that care and supporting the delivery of that care each and every day. And we have to get that right ultimately to impact this conversation in a way that has the greatest value for all of those in our healthcare systems.
Yeah, it's interesting, Jason. When I think about, and I've learned quite a bit from the Barrell as an organization and the different educational offerings that you folks offer your members. But just from a personal standpoint now, when I think about patient experience, 3 years kind of into really creating a formalized program, I think about empowerment, and I think about the word perception here in your the definition statement from the Barrell Institute. And I think it's been wonderful to see how patient perceptions, right, literally have become an empowering, almost a data-driven action point for healthcare practitioners to respond to. And I think that movement itself is improving healthcare. I, as a patient now, my feelings and my emotions and my opinions of my care are now impacting care like never before, and the accountability of it. So I commend you all for seeing that vision back, like you said, in 2010. And I really feel like that fruit's coming to bear here in 2017. I get to be a part of that and feel a lot of the groundwork that you all laid. So thank you for that on a personal note. Thank you so much, Christopher. And if I could add one thing, I think what you've alluded to is really important that we talk about. We have seen a shift dynamically in healthcare away from a patient as a passive participant in their care, someone that is just in a transactional state of play with the healthcare system, to a true partner in care. So whether it is in the pharmacy space or in a clinical room in an acute care setting or in a long-term care facility, we are now in the world of interactions in healthcare, of human being to human being, and that requires a real fundamental shift in our thinking. And it also is being pushed on us by the very patients, as you allude to, with the perceptions that they have. Whether we like the word or not, patients now are consumers of care. And they are making choices. Not every patient has a choice to be in their current situation, but patients and families have choices now in ways they didn't have before, and they're using the broader market as a lens by which to judge how we do in healthcare. And so it's something we have to be very cognizant of and focus on as we move forward as well. Well said, and I couldn't agree more. So kind of getting to, if I'm sitting here listening to this podcast today, and I'm an executive in any element of healthcare, and I'm thinking, I want to build a foundation, a strong foundation for a potential patient experience program where I can really embrace kind of what we've defined in the patient experience. Where does Beryl sit in there? I know there's multiple educational offerings. I myself personally have been through some of the curriculum and been very impressed by the offerings there. But can you kind of break that up into the core programs that the Beryl offers and is behind? Yeah, I would frame it from one aspect of our broader strategy, which isn't made as explicit in our work, but is really intentional in everything we do. That we have really tried in the last 7 years to frame a true field of practice
that this isn't just a nice thing we do in healthcare, but it is a fundamentally central aspect at the heart of healthcare. And so to do that, first, we built a community of practice that we talked about in the Beryl Institute. And I would say first and foremost, before even formal programs, is the capacity to come together as a body of professionals, regardless of what your role might be, with a commitment to improving the experience of those in the healthcare system, both patients and families, and those delivering care. So first and foremost, it is having a network around you in which you can share ideas, glean information, and access content that will help you build a stronger program. And so for us, that's been really fundamental in terms of just the capacity to be able to offer, between up to 40, I think, webinars a year on various and broad topics to help inform people's practices. So part of it is understanding the framing, and it comes back to what you alluded to, the definition. We believe that the heart of this is around culture. So we have to also think about what that means fundamentally as the organizations we build, the kind of people we have in those organizations, and therefore it leads to, I think, the other piece that you were alluding to, how we develop those leaders effectively. And one of the things that we realized in building a community of practice, of building a true field of practice, was we also had to have a body of knowledge, a core body of knowledge that was agreed upon by those individuals. And so literally in 2012, even a little earlier, we began a community broad process that encompassed thousands of voices of people saying, what would be the core knowledge needed? How do we build that knowledge? What is the framework of that? And then how do we ultimately deliver that learning to others? And through that group, through the community, we developed 15 core ideas, 15 core modules called the Patient Experience Body of Knowledge that now individuals can take as one course or another, or in a comprehensive certificate program as well, to develop their skills as patient experience leaders. And it's really exciting because we are seeing this truly becoming part of what people do around the world in engaging themselves in the learning around this patient experience body of knowledge to understand the fundamentals of patient experience and truly how it's evolving, as you've alluded to, dramatically in the last few years. So getting grounded leaders that understand what patient experience is fundamental. And what's really interesting in this path, Christopher, is that it's not just a patient experience leader that engages in this learning, but as you said, you have and others, it is people and organizations that are committed to making an improvement in patient experience. So we see patients and family members, we see consultants, we see frontline nurses and caregivers, we see patient experience people and executives, all engaging in this learning so they have a shared understanding of the body of knowledge to make a difference in people's lives. So that to me is really at the heart of it. To have that community of practice to bring people together, share ideas, understand the power of culture, and then have a framework and a body of knowledge to really drive your opportunity to learn and grow has been truly fundamental to us. And then we've wrapped it, honestly, with a few other resources such as Learning Bites and other topic calls that help people get deeper into the learning, which has been an important part. That this isn't a didactic experience when you engage with the Beryl Institute, but it's truly interactive and it's conversational and it's ongoing and developmental so that we're all in this kind of evolving conversation together.
From our experience, I can recall, just as you're speaking about this, I recall our first interaction with the body of knowledge coursework, and it was one of the webinars. And so here we are a new pharmacy kind of navigating this for the first time. And I think we were one of the few pharmacies at that point that had been a part of the Barrell Institute, which we were proud to we felt like we were in uncharted waters. But here we are in our first educational call. And there were institutions and professionals, patient experience professionals from places like UCLA or, I think Barnes-Jewish was on that call, and all across the nation. I believe there was like 10 to 15, and then here was Heritage Biologics. And we were embraced, even on that first call, the webinar, embraced by that entire group. And you could feel that true collaboration, commitment, and then also the sharing best practices, the embracing folks that come from different areas within healthcare to say, hey, here's what we learned at UCLA, even though you're Heritage Biologics in Kansas City. Here's what our program's like, and maybe here are a few best practices you guys can pull from the hospital institution into your own specialty pharmacy. And I remember, for me, rarely have I joined an organization and the next day felt such a welcoming presence. And I think that culture has manifested into the success of the Barrell Institute. So I just highlight that because when you were talking, I think that oftentimes there's organizations and we feel like you join a company and then or an organization and you're not sure what the value is. For us, it was immediate. And I think that's really behind what you guys do is the authenticity. So thanks again for creating such a wonderful platform.
I truly appreciate that. That is our intent, and to get that feedback is really valuable, because it is, at the end of the day, the common denominator is human beings caring for human beings. And so regardless of the setting you do, and if we can get that right, we've really fundamentally changed healthcare for the better.
On that front, I think some of our listeners might benefit from understanding that there's a lot of what are called chief patient experience officers, even now within hospital institutions, right? That's a growing new leadership role that we've seen happen over the past 5 years. Is that true, Jason?
100%. In fact, I'm sorry.
Yeah, go ahead.
No, I said, in fact, it's been pretty fascinating to watch the growth as we conduct a biannual benchmarking study to understand kind of the growth and trends. And it has jumped tremendously from 22% of organizations reporting having a chief experience leader in 2013 to 58% in our most recent study just this year. So there is a real understanding that you need a focused and purposeful leader in this space. They're not the only ones that own the outcomes in terms of making sure that everyone has accountability in this work, but you need someone to focus and drive the efforts to ensure that you're getting the outcomes you want.
Yeah. No, I think that's very important. I know from our own organization, obviously having buy-in from somebody in the leadership section of an organization allows for that to trickle down and to be pulled up through the organization. And I can definitely attest to how beneficial it's been for our company to embrace it kind of from the get-go. I guess as we've talked here, what keeps jumping in my mind is that this patient experience term that I wasn't familiar with 2.5 years ago, which now is a part of my everyday here, that continues to become, I think, more and more a common term in healthcare today. Would you agree with that? Are you hearing more about patient experience than ever before?
I would say so. Yes, I think people have realized the focus and intent, and I hope that we've played a little part in kind of nudging that boulder up the hill a little bit further. I do think we've seen an evolution from patients' rights to patient advocacy to patient satisfaction to experience, and I think we're still pulling healthcare along a bit on this one. I mean, to realize that what we're talking about in patient experience, while it has that that descriptor of patient in front of it, really is about the experience we provide everybody in healthcare. Because I think we would all fundamentally agree we have to provide the best experience for those on the delivery side of care to ensure the best experience for those on the receiving side of care. So it really is an evolving term, and I think a critical one that we have seen great elevation across all segments of the healthcare marketplace.
What specifically, Jason, that you could hone in on PX as we move forward? Where do you think it will continue to grow? So the growth to me has been so overwhelming when I do try and quote use Uncle Google to research back to patient experience. You kind of see this spike in articles and journals and feedback, and I feel like it is crossing the continuum of care more so now in 2017 than ever before. But what elements specifically do you see continuing to grow as we move forward?
Yeah, I mean, I would come back and maybe I'm a little biased, but I would come back to a lot of the fundamentals we talked about early on in the definition. That, I mean, people really get that healthcare is about interactions, human being to human being. We have to get the interactions right. In order to get the interactions right, we have to have it based on the kind of cultures we build in our organizations. And so the kind of people we have, the expectations we put in place, the strategies we outline. And it's real. What I think people have discovered as a result of that is that experience no longer is just like one of your strategies, but experience is an encompassing way that organizations need to go about their work. I mean, because regardless of what happens, someone in your pharmacy organization, someone in a long-term care facility, a physician practice waiting room today, or an acute care, emergency department, for instance, they're having an experience right now, whether we plan for it or not. And the reality is that experience influences their capacity to get better. It influences their quality and safety outcomes. It influences how they talk about you to others going forward. So it impacts your bottom line. It impacts your community reputation, your consumer loyalty. I mean, it has broad and strong ripple effects. So I think that the idea that experience is about how we deliver on care has really fundamentally shifted in the line of sight that people take at this work. It's no longer just making people happier about service practices or adding tactics on top of a million other things you're doing. It really is about fundamentally changing the nature of the organization that you want to be. And it really is about who you are as an organization, not just the things you do anymore. And I think that's really what I believe we're seeing as a shift. I think you all have exemplified that. You've made a stance as an organization to say, we are going to focus on the RxPX. We're going to focus on what that means for people that engage with us, our employees and those that experience our services. And that's happening, I think, fundamentally across organizations around the world.
Yeah, it's I think going to be even more important as the term I keep seeing now is high performance, right, in healthcare. So it's hard for me to construct in my mind what high performance would look like if you didn't have that large patient experience element, right? So you could have the best cardiothoracic procedure done today in a hospital, let's say. But if the patient themselves felt like along that journey, they weren't well educated on what happened, therefore they don't know how to maintain that ongoing, and I would argue maybe the most important part of that care, which is the ongoing aspect, and that happens a lot of times in the outpatient setting, then it's hard to deliver high performance outcomes in that scenario. And so I think organizations almost, if they haven't been aware of this patient experience movement that's out there, it will almost be put on their dashboard, if you will, because of the definition around what high performance outcomes look like and 100%. The integral part of really knowing how patients feel about their journey. So thank you for those insights. We're going to take a quick break from one of our sponsors to get a message in here real quick. But when we return, we will be with Jason Wolf as we explore a little bit more into the specificity around membership into the Barrell Institute. So hold on, sit tight, we'll be right back.
As the specialty pharmacy landscape continues to rapidly evolve, a new patient-centered approach to care has emerged. Physicians, payers, employer groups, and manufacturers are demanding an alternative to the traditional pharmacy product distribution model. Heritage Biologics Rare Disease Outcomes Management Program delivers a first-in-class value-based specialty pharmacy solution that has turned patient experience into a measurable outcome. Patient-reported outcomes, measures, and quality-of-life assessments are combined with pharmacy patient experience metrics to provide real-time analytics for all stakeholders involved in the continuum of care for each patient. Heritage's commitment to this high-performance collaborative care model is redefining the way accountability measures can improve outcomes. Are you happy with your current pharmacy partner? Maybe it's time to expect more. Maybe it's time to measure more. Heritage Biologics. We measure it, we report it, we share it.
All right, we're back here with the Specialty Pharmacy Podcast Network, an episode that I think is extremely meaningful for all of us specialty pharmacy executives and pharma executives that are out there, maybe learning about the Barrell Institute for the first time. I'm with Jason Wolf, and we're taking a look now, shifting direction into where can pharmacies and other healthcare agencies, and I guess I can even say that one of our colleagues is a telemedicine provider that I know recently got involved with the Barrell Institute. But where do you start when you look at exploring membership opportunities with Barrell, Jason?
Yeah, well, I will be, what's really exciting about the way that we've structured the Barrell Institute, as we talked about before, is being a community practice. So its strength is in the people that are engaged, and it has purposely not limited itself to one segment of the healthcare system. And I think and I appreciate the feedback you got about feeling welcomed in the community from your space into the broader arena of healthcare participants. For us, we are about making sure the word of patient experience gets out. So I think it's fair for us to say first that probably about half of everything we do is open access to the world. We want the information out there, but we also believe that there's a benefit in being part of this community as members. So we have really two primary paths for organizations to engage. One really is an individual. If you want to try it out and see what it's like, you can join the Barrell Institute as an individual, and you have access to everything that the organization has to offer. And members have access to our white papers, our entire webinar series, discounts to our conferences, and many other resources such as learning bites and topic calls. So there is a plethora of resources that you have access to that we believe is one of the best values in healthcare. Simultaneously, you can also join as an organization. We've tried to make it very accessible to organizations. And the way we've set it up is while an organization can join, once your organization joins, every individual within an organization ultimately becomes an individual member themselves. So as you can see, our hope is ultimately that people engage one-to-one in sharing their thoughts, ideas, engage in the learning and the opportunity. And it really is through those two paths in which organizations can join. And I think as you mentioned, Christopher, organizations from across the continuum are engaging, and that's the most important part. This is, while I think we had roots in the acute care space, We include pharmacies such as yourself. We see many physician practice groups engaged. We see long-term care organizations becoming engaged. You said telemedicine and technology providers. And we actually gain from the robust nature of that conversation because all of us bring exciting and I think important perspectives. So we have truly worked to encourage the multiple voices to become part of our membership community for that very important reason, that we all bring something of value to learn from and to give to each other in order to improve the healthcare conversation overall.
I think it's great, right? So going back to the term continuum, I feel like there's often been gaps that break down when it comes to patient experience. So let's say I have a great experience within a hospital system and they're very committed around patient experience, but then I get transitioned into an organization, a healthcare provider maybe that doesn't have that formalized program set up. And so I go from being very excited, feeling like my voice was being heard, feeling more empowered, more engaged in my care, and then I might go to a provider, maybe they have not created such a program, there's a little bit of a dip. And I think the more we focus, like you mentioned, on including everyone, the more we can formulate programs in which that gap kind of gets bridged. And we spend a lot of time talking about that here at Heritage as well. So I appreciate the openness that the organization has to getting everybody involved. And I think the winner of that ultimately is the patient, which is the main goal. I think, from a specialty pharmacy perspective, we also have home infusion nursing here. We've gotten involved in multiple different ways, but I think the certification programs kind of take the body of knowledge to the next level. Can you highlight, I believe there's a few different routes you can go. I know most recently we're very proud that one of our leaders was one of the first in the CPXP, the Certified Patient Experience Professional class, but can you kind of break down what those opportunities look like?
Yeah, so there, clearly, as I mentioned, sort of the grounding of all the general knowledge you can obtain. And we mentioned then the body of knowledge, which if you complete all 15 modules and you go through, we built interactive courses that are discussion courses associated with each of those modules. If you complete that program, you end up with a certificate in patient experience leadership, which is a certificate of completion. We realized as part of that framing the field that we talked about before, that not only did you need a community practice and a body of knowledge, but a truly formulated professional designation. So we created a separate entity, the Patient Experience Institute, as a standalone entity that provides certification and continuing education support for patient experience professionals or those interested in attaining that designation. So individuals actually sit for a psychometrically validated exam. They sit for that exam. If they pass, you get the designation of CPXP. I can say it's much like if you went to ACHE and got your fellowship, or if you got your CPA as an accountant. I mean, it's a very similar and rigorous process, a very thoughtful process that was validated by a number of members across the community. So we actually are excited to say in the first 2 years of that program have over 500 individuals around the world now with the CPXP designation. So there is a standout there as well for making this a professional designation and having this be truly part of the central work of healthcare overall.
Well, it sounds like you have heard this from other members, but I can tell you from our standpoint, there's a few hospital organizations that we work very closely with in which a patient will be transitioned to our care in the outpatient setting. I can tell you the organizations that are also a member of the Beryl Institute, when our cultures, right, our clinical teams speak that same language, it's been almost, I would use the term, beautiful thing to witness, because we're able to provide feedback back to that hospital institution that knows exactly what we're talking about. So I can tell you that continuum and kind of bridging the gaps that sometimes exist happens in real time. We get to see that behind the scenes. The patient feels more of a seamless transition, and probably just as important, with our institutional partners that don't have a current formal patient experience program, or that they haven't been exposed, if you will, to the Barrell Institute, we are able to do education and say, hey, listen, here's an opportunity maybe for you to even learn from us as a Barrell member, and almost cheerlead, if you will, the other accounts adopting more of the formalized aspects of patient experience. Because when you can actually see data that we're able to provide, and we take a lot of pride here at turning patient experience into a, quote, measurable outcome, I believe it gets a lot of people's attention. So, I mean, I guess I'm transitioning here to another question, but where you sit, in your leadership role, Jason, I'm sure you've seen different ways in which organizations have focused on making patient experience more measurable, meaning how are we doing? and I think HCAHPS would be identified as the most common way hospitals have viewed a snapshot of how are we doing even outside of the clinical outcome, how are we doing around the overall experience. What are some ways you're seeing PX data being used to kind of improve care on that more macro level, if you will?
Yeah, I think this is a critical conversation. And I wrote a bunch about this actually for ACHE and a couple other organizations this year around the fact that I believe, and this is from my operational experience as well, that we have done a lot of great work in healthcare over our life cycle, regardless of what setting we're in, across the continuum, to drive clinical outcomes in some ways, to drive financial outcomes through other paths, to ensure customer loyalty, through other paths, and then community reputation in other means, right? And you could see where you can actually envision that as an operation in operationalizing healthcare, that each of those could take different trajectories or different work streams. In fact, when we focus on experience, I believe you can actually drive all four of those things. So a commitment to experience, and I want to start from the end before we go back to the beginning here. If you focus on experience, I believe you see clinical outcomes, because if we look at experience from quality, safety, and service, the integration of those things from the perspective of the consumer, then first and foremost, you can use the information around experience to track how you're doing from a quality perspective and make improvements, address safety issues that you might otherwise have to address. And what we find is organizations that focus on experience in that realm, for instance, have stronger team communication, so less opportunities for error. They have clearer processes that they follow because of the stronger culture that exists. And so quality processes and procedures seem to hold together. That the service clearly for individuals is penultimate among other organizations. And so they actually experience a better sense of care. And you find that when patients and families feel that, they tend to get better faster anyway. And there's data more and more every day that supports that. I mean, similarly, I think financially we could draw streams to that and say, your financial indicators are actually a way to measure and tie back to your experience outcomes, because you do see, obviously, people choosing your facility. You see higher referral rates. You see, because of quality, lower readmissions and lower errors that cause costs or drains on even reimbursements for hospitals and other organizations. And so to me, if you can see where I'm going with this, it's the linking of data to outcome that's most important. Clearly, consumer loyalty. I mean, people choose you and tell others to choose you. I just was doing a consumer focus group just a week ago, and that was the one thing that an individual said. He said, I've been an old hospital administrator. I understand how this works, but I'll tell you one thing. If you guys screw up, I'm going to tell people, and they're going to tell people, and they're going to tell other people. And whether screw up is you treated me or my family member bad, or you did something clinically wrong, that story is going to get out there. And so that consumer loyalty, that choice that people have is important as well. And then clearly all of that kind of is kind of builds to this idea of community reputation as well. So all that to say, I think people are now pulling data to really make choices, and they realize if a focus on experience can enable them to drive those four key outcomes that we all look to drive across healthcare, then they're actually really able to make the kind of improvements they want. And if we look at it, I think the term that was important in your question is the macro level. If we try to work each stream as an improvement stream, then sometimes we step on ourselves, or we even get in that game of whack-a-mole, I like to say, where we're fixing one issue and letting another one get worse. A focus on experience enables a comprehensive opportunity to drive outcomes, and you can use a series of broad metrics to tie back to your experience efforts to ensure you're achieving those outcomes you want to achieve.
Well, it's very, very interesting. I think our listeners are familiar with me referencing, there's a company called Amazon, Jason, out there in the world. I'm not sure if you've, but they've been on our radar in the specialty pharmacy world because they are now going to be entering the pharmacy space in some capacity. From my perspective, what I've shared with our listeners before is I find it amazing today, as I'm a consumer, let's say I referenced a lawn chair. This summer, my son was playing T-ball. We learned that we needed to have comfortable chairs. And I went online, and there was this particular lawn chair. There was like 897 star reviews for a lawn chair that cost $70, expensive chair. And I learned in a very, quick amount of time, the pros and cons to this chair, why it was 4.5 stars, was it worth the money or not. I knew more about this lawn chair that I did when I then took that same child to the urgent care that same week before I met with my doctor and knew exactly what I was paying for in healthcare. I continually feel like the star ranking system that Amazon has that we're all familiar with is going to intersect at some point with patient experience, where that same type of STAR metric or performance accountability or feedback loop will continue to help us, so that when it's not a lawn chair, but it's I'm going in for this procedure, or I went to this ER, or I went to an urgent care, I, as a consumer, will learn about other folks' patient experience or patient journey and the value of that to me before I select who I'm going to entrust my care for my child to, or just as importantly, a disease state that somebody's gone through that I can learn what that journey is like. There's a sense of empowerment in that information alone that I feel like we will benefit from by focusing on patient experience well above the business financials of you want to be retaining customers, if you will. And I think that's what gets me so passionate about this patient experience movement. And it's really what has me back in healthcare and staying in healthcare. So I see a lot of hope. Mm-hmm. So I guess I'll finish with our last question is, as a leader in this patient experience movement, where do you see it going in the next 5 years? Do you see that kind of that mantra of patient experience giving hope to a lot of us out there, or just in general, where do you see us going?
Well, this year we really reflected on that question ourselves, so it's a great one to end on, and I appreciate that. We at the end of our State of Patient Experience report this year that we released in July said that as we've evolved, and I think I've alluded to it a bit in what I've said, that so has the conversation. And so our commitment, our cause, sort of refocus is that we have to change healthcare by advancing an unwavering commitment to the human experience. And so when we think about what that means, I think it's a lot of the stuff that you all are doing and exemplifying in your work. That if we focus on the true human experience in healthcare, we have to have a definition, a foundation for action. So as I alluded to, we have one, that we have to recognize that this integration is critical, of integrating quality, safety, service, that we have to look beyond clinical encounter. And I think as you talked about too, the cross-continuum perspective, but also what's very important, those transition points, the synapses between places, and hopefully we're helping to bridge that gap a bit through the Institute. We have to recognize it's about partnership, and it's not just partnerships with patients and families, but it's also about the partnership among organizations and among institutions to ensure that seamless continuum as well. And it's really a focus on outcomes, like we just talked about before. That if we realize that a commitment to the human experience in healthcare is the ultimate way to drive all the outcomes we strive for, that's where I believe the market is moving. Where they probably still struggle is to wrap their hands around the tangible nature. It's probably a lot easier to drive back down to clinical checklists or to think about making process improvements for safety. And those are all tactically important. But the market is shifting for healthcare, and it's going to require our healthcare organizations to think differently. And I do think it is about that unwavering commitment to human experience and all the things we've been talking about for the last few minutes. It's going to take to get there. So that's the shift I hope people will consider. And it's the direction I think that we're going to see healthcare moving on a global nature. And it's an exciting opportunity for all of us. It means that we have, as you alluded to, Christopher, we have boundless opportunities. We have an opportunity to truly impact the lives of the people that we encounter each and every day in our work. And that is something that we should all feel very lucky to have the chance to do and be inspired by each and every day. So I feel very lucky to travel this journey, and I'm glad to have the chance to travel it with you as well.
Well, thank you so much, and I'll pick up on the word and the term you just used there, and that's inspirational, right? And I from my heart to yours, thank you for the noble work that you're doing. I appreciate this element of healthcare, probably more so than any other aspect of my day-to-day. And I'll finish with this in my closing remarks. As a specialty pharmacy executive who also does a lot of home infusion nursing, and our patients come from the rare disorder community oftentimes, and when you're wrapping your mind around, should I or should I not be invested, or should patient experience be on my radar and not from the executive level, I'll share just a quick story. We recently had a patient who was getting a 4-hour infusion, and because of our commitment to patient experience and allowing patients to have a feedback loop in which they felt very confident that this information was only shared with their patient experience professional, the patient actually let us know that they didn't feel comfortable in their home setting, and that's why they wanted to get off of this life-saving therapy. And we never would have known something like that had we not committed to a patient experience program. And by being able to understand that not only did the patient not feel safe in their own home, they were also struggling with depression issues, we were able to provide them with resources around their patient journey that has kept that patient on service and almost off of the therapy that they were depending upon. So I highlight that as the old, hey, this is the why as to why you want to be interested in a program like this, but also kind of circling back to why we're all in healthcare. Being a champion for patients and really impacting that particular patient's care journey is something my entire staff felt very, very proud to have been able to accomplish. So with that, feel free when you get a minute to visit the Barrell Institute's website. It's www.thebarrellinstitute.org. It's a great place to kick off and to explore your journey through patient experience. And as always, keep the comments coming back to the Specialty Pharmacy Podcast Network here. I can't wait for our next episode. And again, thanks to Jason Wolf and the Barrell Institute for joining us here today. Cheers.
Thank you so much.
Thanks for listening to the Specialty Pharmacy Podcast. Be sure to share this podcast with your fellow pharmacists, doctors, and healthcare providers dedicated to optimal patient care. If you have ideas for future episode topics, please email the Pharmacy Podcast Network. Send your message to publisher@pharmacypodcast.com.